Welcome to Busitema University NaPRiC Products Research and Innovation Center.
Welcome to the NaPRiC Products Research and Innovation Center. I'm Catherine Nabitandikwa, the research scientist here.
And my name is Moses Obio. I'm a laboratory technologist at NaPRiC Product Research and Innovation Center.
I'm Professor Yahya Gabamkulia, Deputy Center Lead at NaPRiC. I'm an associate professor of biochemistry and molecular biology in Busitema University.
Kenneth Chimba, the Chief Scientist, Preclinical Studies at NaPRiC Products Research and Innovation Center, NaPRiC.
My name is Lukwago Kuotweti Detoni. I'm a lecturer in the Department of Pharmacology and Therapeutics. I also work as an ethnobotanist at NaPRiC.
My name is Maureen Mgaya. I'm a medical doctor and I work here as a research project coordinator.
Dr. Chibuka Ronald, the Research Administrator of Busitema University NaPRiC Product Research and Innovation Center.
I'm Semakura Ashraf, an intern student at NaPRiC Product Research and Innovation Center. I'm practicing what I learned in theory in a practical form.
Dr. Boris Adoriko, the Chief Scientist and a Senior Lecturer in the Chemistry Department. We keep records of our plant specimen. We collect from the wild. Through bulk extractor, we convert the raw plant materials into potential extract, which are then formulated into therapeutic products.
My name is Dr. Okello Joseph Francis, a molecular virologist by training, senior lecturer and head of biology department at the Faculty of Science and Education at Busitema University. At NaPRiC Products Research and Innovation Center, I'm the venture leader of the PROVRID project. The PROVRID project aims to develop natural therapeutics for management of HIV infection with a focus of developing a cure for HIV/AIDS from natural products derived from Ugandan medicinal plants. This project is fully funded by the government of Uganda through the Science, Technology and Innovation Secretariat Office of the President and the Busitema University Research Innovation Fund.
My name is Dr. Ndima Moses. I'm a senior scientist at NaPRiC. And I'm in charge of pharmaceuticals and quality assurance, so trying to ensure quality of products that come out from NaPRiC. By training, I'm a chemist, and so in terms of the research that I do, my research is on application of nano materials as drug delivery systems for natural products. And particularly, we appreciate the fact that natural products have big limitations in terms of their solubility, and so I kind of develop nanomaterials that can be used as drug delivery systems, therefore targeted application, but also control the release of natural medicine.
I'm Richard Uloyadome originally from Makerere University, but now relocated to Busitema University. I've joined my colleagues at the Faculty of Health Sciences at the campus of Mbale. NaPRiC as a building, I can see, which is funded by the government of Uganda, and has even funded as well as other softwares like machinery and components that are used for the extraction and screening of herbal products. And therefore I find Busitema has gone a very long way into research with herbals. I've seen some of these herbal products at Busitema already registered with National Laboratory.
My name is Dr. Samuel Beko Bakiro, the Center Leader of the Natural Products Research and Innovation Center at Busitema University here at Mbale campus. This center is supported by the government of Uganda through the Secretariat of Science, Technology and Innovation with the purpose of conducting research and development on natural products, particularly medicinal plants, and transform them into pharmaceutical products. This center aspires to be a center of excellence in training, research and development of natural products to contribute to socio-economic transformation of Ugandans through value addition on its natural resources and the technology development that supports sustainable use of natural products in agriculture and health.
Professor Dan Chibule, the Dean of the Faculty of Health Sciences here at Busitema. We are really glad for the upcoming National Science Week. As Busitema, we believe in science. We are 7 campuses, each one of them offering a unique science. Here at the Faculty of Health Science, we are into health sciences, more of training, but we emphasize research to lead other areas of training as well as our impact on community. And indeed, we believe that aligning to the national agenda of making Uganda the very best, research comes at the forefront. And that's what we put at the forefront within our university as well as the faculty. We want to be research driven. A successful nation has to be research driven. So broadly in the Faculty of Health Sciences, though we are established to train health professionals for our country to drive our national agenda in science, especially health science. As we are aware, pharmaceuticals are on top of the agenda of our national development plan, and a lot of research, a lot of investment has been made to align on developing our indigenous knowledge in herbs, as well as other natural products in order to uplift, the plight of our people. As you may be aware, Busitema is one of the institutions, and exactly here in the Faculty of Health Sciences, where our first herbal product went through a clinical trial. Thanks to the support from our government for enabling young scientists, as you'll see in our center, NaPRiC, Natural Therapeutic Research and Innovation Center, is one of the leading centers when it comes to natural therapeutics. There are a number of products under development with the support from the Ministry of Science, Technology and Innovation, as well as our government. It's impossible. It becomes a mountain to develop research agenda without support from our government. So we have many products in line for diabetes, for HIV, to address the priority health issues that our country is slowed down, and health is among the priority things to see that our economy grows. That said, it's not only herbal products. In this faculty, the agenda also pushes into issues of maternal and child health. As you're aware, we are unable to meet indicators regarding maternal, neonatal and child health. So we also have a team that is working diligently, doing research within that area in order to improve maternal and child health within this region. Many grants have been fronted from this side, and in a collaboration with Mbale Regional Referral Hospital, and very key partners like SID Global have been able to push this agenda in the area of maternal and child health. Number 3, we are also interested in the area of pre-operative as well as critical care. We have a team which works with a larger network within East Africa and globally to see that patients access critical care within their environment. And a lot of lives are claimed on the roads, and many people cannot access this important service. So there's a dedicated team that does research within this particular area. Another research group is our education. We have to improve our education, especially health professional education, to see that the Ugandans are competent to do what they are supposed to do, that they become innovative. We have also dedicated a particular research within health professional education in order to foster this critical agenda, because training is at the center of our national development plan to build capacity. So research is at the forefront of this health professional education program. So in a nutshell, our research program is well aligned to the national development plan. And lastly, we do research in order to improve our community. And of recent, we are encouraging more of community-based cohort studies, and 2 community-based cohort studies are coming up. One in Butaleja as well as Butembo districts in order to set up long-term projects that improve health of our people within the districts. Another cohort that we are going to work together with another organization, ANECA, which is to improve outcomes in maternal and child health, is to do with improving immunization outcome. Again, this is a population research that has impact on community, to see that mothers, take up their children for immunization and improve outcomes. That will be done in districts, the districts in Tororo, Chibuku, and other districts, and that's the direction we are taking, to do research that has direct impact on our community. I would like to thank you so much, and I would like to wish you a successful Science Week for Uganda. We believe research is to drive us in the right direction. We would like to thank you all, especially our collaborators. Thank you.
I'm Professor Pakoyo Kamba, a pharmacist with specialization in virology and molecular biotechnology. As a scientist, I support NaPRiC with mentoring of scientists and the research team. I also use my wide experience in grant writing and resource mobilization, leveraging on my wide network of global collaborators to mobilize resources for the development and operations of NaPRiC. I am working, building on my background in molecular biotechnology. I'm working on establishing a center for research and innovation in biological products, particularly protein therapeutics and vaccines. As the Deputy Vice Chancellor for Finance and Administration, I oversee financial management processes and systems in the university. And in that aspect, I support NaPRiC in complying with grant and donor financial management requirements. I thank you so much.
I'm Professor Paul Wako, Vice Chancellor of Busitema University. I also happen to be a pharmacologist by background. And I would like to use this opportunity to extend my gratitude to the Science, Technology and Innovation Secretariat for the great change that we are seeing in the university. Previously, universities were working around research, training and outreach, but we have been able now to embrace the product development, innovations and product commercialization. I believe this is a great transition in the philosophy under which universities operate today. In the past 2 years, Busitema University has been involved in development of several products which are used in pharmaceuticals. One of the examples is Tazkov, which has come from our team at the Natural Products Research and Innovation Center in Mbale, and several other products across the university. For this, we are extremely grateful, and it is making universities much more relevant than before, and we think that this is the right direction the country should be taking. We are grateful to the STI Secretariat for the wonderful work it has done, the government of the Republic of Uganda for emphasizing science, and of course His Excellency the President, whose commitment towards development of this country through science and technology has been immense. We are extremely grateful.